Well, a warm welcome to all of you. Let me truly start by saying thank you everyone who is attending this webinar today. My name is Mbuso Dabula, and it is a great pleasure for me to serve as the Healthcare Manager for CAN Pathways Immigration and Recruitment, which is dedicated to serving all of our candidates. And many of those candidates are actually you, international medical graduates and internationally trained GPs that are joining here today. Now, fortunately, we have some extremely talented experts with us today, experts who are respected in their field of expertise. We first have a GP who needs no introduction in the UK, and some of you know him as the Medical Director of Emedica, Dr. Rahman. Thank you for your support and making the time to be on this webinar. So let's dive right into it with our panel. And we are going to call upon Dr. Rahman first to introduce himself and tell us more about GP practice in the UK, Emedica, and everything in between. Dr. Mahbub.
Thank you so much, Mbuso. So first of all, CAN Pathways and Emedica are working together to host this. So thank you to all of you that have joined. For those of you that have been to an Emedica course at some point in the past, whether it was as part of getting into GP training or for MRC GP or our post-CCT careers, it's lovely to see you back. Some of you might be new to us, so welcome. So if you haven't met me before, just a brief introduction. So my name is Rahman. I'm a portfolio GP. So what that means is I'm a GP with multiple roles. So clinically, I'm a partner in my own practice. I've worked as a locum in various other practices. I've worked in lots of different roles over the last 20 years. I worked in prison GP. I've worked with the Royal Army, assessing people applying for officer training. And I've been involved in humanitarian and global medicine with doctors worldwide over the last 20 years. So I've been to Pakistan, Sri Lanka, I went to Greece with another organization, Bangladesh, and last month to Malawi, either teaching or seeing patients or a combination of both. Most of my time now is involved in medical education. So I'm the medical director of Emedica, a consultant in medical education. I'm on the NICE GP reference panel. I've worked with the GMC. I used to be an examiner and invigilator for the GMC for the PLAB Part 2, which some of you will have done. And I mostly now, either I'm teaching for Emedica or working with other organizations like the Medical Protection Society, different deaneries to help people in GP training get through their exams and then with careers. I wrote this book, GP Jobs, A Guide to Career Options in General Practice, back in 2010. And our team at Emedica have now trained over 83,000 delegates. We're celebrating our 20th anniversary this year. So welcome to all of you. As I mentioned, I recognize a lot of names. A lot of you have been to some of our things before, but for those of you new, welcome. So really, I'm just briefly going to talk about some of the similarities and differences between general practice in the UK and Canada. And I'm going to hand over to the other experts in the panel who'll talk about licensing, finding jobs, registering with the MCC, with the CPSA, and so on. But just a few mechanics of the webinar. If you've got a question that you'd like the faculty to address in the end in the Q&A session, please use the Q&A to ask those questions. So let's talk a little bit about GP in the UK compared to GP in Canada. I'm going to talk a little bit about these things. So if we start, there's actually a lot of similarities and a few differences. So if we look at the healthcare system, both the UK and Canada have universal healthcare systems funded through taxation or national insurance or combination. One slight difference in the UK, patients then access that directly. So i.e. it's free at the point of care. When they go to their GP practice, they don't pay to be seen. Depending where you are in the UK, you may pay a prescription charge. That's nothing to do with the cost of the drug. It's how many items you have. There are variations, for example, in Scotland, in Wales, prescriptions are free. In England, people pay a charge. In Canada, when they access it, it's via a public health insurance, sometimes known as Medicare, but it's specific different public health insurance plans in the different provinces and territories. So, healthcare is actually delivered, while there's the Medical Council, which is an overarching, and there's a federal healthcare that funds some things, there is individual provinces. So there's 10 provinces and 3 territories, and there are differences in terms of what is funded or how much people might have to pay, but also in terms of registration from your perspective to actually work as a GP, which we'll touch on. In terms of regulation and licensing, so in the UK, once you're on the GMC GP register, whether you've got your full MRC GP and then got CCT because you did GP training in the standard pathway in the UK, or if you either did non-standard training or you trained outside the UK and then were recognized as equivalent using the CEGPR, In the UK, that's universally recognised as the same. You can work as a GP as long as you're on the performers list, and you do need to be on the performers list for the country you want to work in. So for example, if you're on the performers list in England, you can't work in Wales or Northern Ireland or Scotland unless you register with the local performers list there as well. In Canada, the Medical Council of Canada, if you've got MRCGP and CCT, you're going to be accepted. In some provinces, you're not going to need to do any exams at all, not even MCCQE1. Okay, there's some recent changes for that. If you've got CGPR, that's variable. In some provinces, it may be accepted. In some cases, it may be accepted, but you might need to do some exams. You'll need to check that on an individual basis. Okay, so as well as registering with the MCC, you then need licensing and will be regulated by a provincial body. For example, for Alberta, it will be the College of Physicians and Surgeons of Alberta, and they'll be speaking later. And then you also need to get your qualifications recognized, if you like, and certified by the College of Family Physicians of Canada. Okay, you get CCFP. It's equivalent to like having a CCT in the UK. In terms of working pattern, again, quite a lot of similarities. Some of the slight differences. In the UK, if you're working as a salaried GP, your working hours, if you like, what you're working with is based around nominal sessions. And one of the issues with that is what a session is different to different people. So why the BMA talks about a nominal session being 4 hours and 10 minutes. Those of you already working in different practices, you might know in some practice, an actual session could be 5 hours. It could be 5.5 hours. It could be 6 hours in a different practice. In a very few practices, it will actually end up being 4 hours and 10 minutes. If you're a partner in the UK, how much you make is broadly based on how many patients are registered in your practice. So capitation. It doesn't matter if you see that patient once a year or 100 times a year, you won't get paid more or less on the core funding. There's additional funding for things like enhanced services. So, people that might do additional things, you might get additional income. Full-time is generally recognized as 9 sessions, which normally for salaried is about 37.5 hours. And normally that's 8 clinical and 1 that should be CPD. But if we look at the reality, while that's on paper, average for a full-time salaried GP is about 40, sometimes a bit more hours, depending on the actual working hours. And if we look at full-time partners, they're often working 50 or more hours. Out of hours, whether you're salaried partner is optional. And a lot of practices, one of the things that you're all aware that working in UK and GP, it can be time pressured. So a lot of practices are still on 10-minute appointments, which I find really challenging 24 years into clinical practice. Some of the better practices now have 15, and you have some that are somewhere in between 10-minute appointments, but one blocked off every hour. So it's like 12 minutes. And you all know that's really difficult, especially if people have had to wait a couple of weeks to get an appointment, and then they save up more than one problem. And one of the other issues, which is a peculiarity in the UK, I'd say, if you look at GP through most of the world, is that we still often have practices where you'll have home visits. And if you look at Canada, again, depending where you are, and even within a region, sometimes different practices will vary. You'll largely be paid either if you're salaried based on your hours worked, or in a lot of cases, you get a fee for service. And some have a blended, some fee for service, some capitation, depending on how many patients are in your practice. But I think one of the big things is this fee for service, which we don't have in the UK. So in Canada, if you're seeing more patients, and within that, for different patients, you might be doing more. So for example, I do joint injections. And if I were to do joint injections, there'd be an additional fee for that because it's a different service. It requires another skill. Some of you might fit coils and implants, for example. Some of you might have additional skills. And if we look at nominally full-time, 38 to 40 hours, but I was looking up on the Canadian Medical Association's website, and actually when they surveyed, average GPs working about 51 hours. And one of the things is people will often do additional hours. So I've got a friend who's been a GP in Canada since last year, and another one that recently went. And he sometimes is there in the evenings, sometimes he has clinics on weekends, but that's because he can do additional things. He did surgical training as well as GP training. And so, by doing things and doing some procedures, he can significantly increase his income. Out of hours, on-call is optional. If you're in a more rural area, you might also have the opportunity to cover emergency department if you've got things like ATLS and ALS skills, and that can bring in additional income. One of the things that's different in terms of appointments, most practices will have 15-minute plus appointments. If you look, there's a paper in the BMJ, they looked at average GP consultation appointments throughout the world. And Canada had one of the longest ones if you looked in the world. UK sort of in the middle, and you go down to some places that are less than 10 minutes. And in some practices, it'd be 20 minutes. Home visits are not at all common in Canada for GPs to do. There might be other services that might offer care in the community, but it's not common for the GPs to go out. And then last thing I really want to talk about before I summarize and hand over is income. So I've taken this so that we're comparing fairly like to like, both from governmental resources. So from the UK, the government publishes a report based on tax data. So because the tax year, there's a year delay. So this is based on 2023 year-end tax data. If we looked at salaried, because ARRS came in, you see some of those are really quite low paid. So it's from as low as £8,000 per session per year to as much as £11,500 or even more per session per year for salaried. If we look at the average income, depending on whether you're in England, Wales, Scotland, Northern Ireland, it ranges from as low as 69,000 to 78 as an average. So, for example, Northern Ireland was 69, Wales was 78, England and Scotland are in the middle. But this includes those that are working less than full time. For partners, from as low as nothing, because some practices shut down and partners had to fund a redundancy pay, so actually made nothing or even a loss, to £250,000 plus per year for some high-earning practices, especially those where they have multiple practices and they can also potentially make income from the building side of things. If we look at an average, which is probably a better way to look at it, ranges from £113,000 a year in Northern Ireland to £158,000 a year in the last tax year in England. If you compare that to Canada, again, on the government website, the Canadian government has a jobs website where they collect data. The lowest that they had on there was 85,000 Canadian dollars, equates to about £45,000 with current exchange rates. But that will be for someone working less than full time, to over 450,000 Canadian, which is about 239. And the average, the median they had was 227,000 Canadian, about £120,000 with current exchange rates. So, income will vary by where you're working, what skills you've got, how many patients you're seeing, if you're able to do procedures and how many you do, but also the practice split, because often you get your gross income, you'll give a proportion. It might be 20%, it might be 25%, it might be more or less, depending on what's negotiated. And that's one of the things CAN Pathways will help you negotiate with the practice to cover, admin support, the building rent, the lighting, all of the other additional costs. Okay. So to summarize, look, if you've got MRCGP and CCT, you can get your letter of good standing, you're going to get recognition in Canada, and in some provinces and territories, there'll be no need for any additional exams at all. On average, there's longer appointments, and especially if you've got additional skills and you're willing to, see patients and do those things, there's a potential for good income. And most GPs that I've either read about or talked to that worked in the NHS first and then moved to Canada, one of the things that they report is that they feel really respected, that they feel appreciated, because in some areas it actually can take a long time. There's a waiting list to get onto the books of a GP practice. And so when people can actually find a family GP that they like and can go and see regularly, they really appreciate that. So I think that's one of the things sometimes in the NHS, we get a bit the opposite sometimes, that people sort of say, oh, I pay your wages because I'm paying my taxes. And sometimes they take us for granted here. So that's some of the things that I've seen. So, that's just a summary of some of the things. So, lots of things similar. And the other big advantage, of course, that there's, for most provinces, you're straight away able to go in and work. The language is the same. A lot of the guidelines they use are similar, which is why there's cross recognition between RCGP and the Canadian family GP sort of college, is because a lot of our guidelines, a lot of the kinds of way that we practice are very similar. Okay, so I hope you found that helpful. If you've got any questions, post them in the Q&A. I'll pick some up as we go, but the rest will be picked up at the Q&A at the end. But I'll hand you over now back to Mbuso, who will introduce Dr. Santos.
Thank you so much, Maibu, for that very detailed presentation and lots of information, indeed, very helpful information. Well, before we get to Dr. Santos, we're going to have our founder and CEO, Harpreet Kaur, as the next speaker. And so I'm going to hand it over to Harpreet at this current time.
Thank you so much, Musa. Hello, everyone. My name is Harpreet Kaur. I am the founder of CAN Pathways Immigration and Recruitment firm based here in Calgary, Alberta. I am also licensed immigration and recruitment consultant. And through my firm, we specialized in supporting healthcare professionals from around the world in building successful career here in Canada. I also want to take a moment to thank all the speakers from MCC and CPSA who have taken their time today to share their insight and provide valuable information in this webinar. I want to especially thanks to all attendees who are considering their career as family physicians in Canada. So at Can Pathways, we work closely with foreign trained physicians, helping them navigate the licensing process in accordance with Medical Council of Canada and CPSA, College of Physicians and Surgeons of Alberta guidelines. We provide individualized end-to-end solutions tailored to each candidate's needs, from guidance on navigating complex licensing requirements to securing employment in Canada, job offers, and eventually leading to work permits and the immigration process in Canada. For Canadian clinics, we also provide very comprehensive guideline services where our services starts from identifying clinics who are in need of doctors to offering step-by-step guidance on recruitment requirement. This includes preparing and submitting LMIA applications, which is Labor Market Impact Assessment. We submit those applications to ESDC, Employment and Social Development of Canada, also called Service Canada, to obtain and then obtaining job offers and then guiding physicians through their work permit process. So whether the pathway is LMIA based or LMIA exempt, we ensure the smooth transition and the process is efficient. Our vision on starting Can Pathways comes from my own journey. Me and Sham, we both came to Canada as immigrants and students. So we understand the first-hand struggles everyone go through, the stress, the uncertainty involved in the process. Moving into a new country itself is a huge challenge. So that experience inspired us to create a firm that offers the right guidance step by step so people can have a peace of mind when they're considering Canada. So our goal is to make this transition smoother, not only into the Canadian healthcare system, but also to the Canadian communities. So we understand that every candidate's process is unique. So for some people, the goal is to first come and explore Canada and then eventually bringing family together. But for some people, they want to move to Canada as a family, as a unit. In either case, our role is to ensure the transition is smooth and we provide clear pathways to permanent residency and helping professionals and families to choose Canada. And that is some of the introduction that how our company is working. We provide immigration and recruitment services, but I would get into more details about immigration services, how it will help doctors to call Canada home, like the permanent pathways later in this webinar. But for now, I will hand over the screen to Sham Pathak so he can discuss further. Thank you.
Thank you, Harpreet. Good afternoon, everyone. My name is Sham Pathak, and I'm the managing partner at Can Pathways. My role is focused on helping international doctors transition, settle, and succeed in their Canadian journey. First, I'd like to thank the representatives from the CPSA and the MCC for joining us today. And most importantly, thank you to all the doctors here who are considering building their careers in Canada. At Can Pathways, we recognize that once provincial licensing bodies such as CPSA confirm your eligibility, your real journey begins. And our role is to walk alongside you in that journey. As a doctor, relocation, and placement advisor, my focus is ensuring that your placement aligns with your professional goals, patient care interest, and lifestyle needs. We also support you and your family with settlement from accommodation and transportation to schooling for children, setting up bank accounts, connecting you with accountants for your professional corporation, and guiding on health card, SIN number, driver license, etc. So you feel home from day one. And as your career progress, many of you may wish to establish your own clinic or expand your practice. Even at that stage, we continue to be your partner. assisting with clinic establishment, staffing, operational support, and long-term growth strategies, so you can move confidently from practicing medicine to building your own legacy as a physician entrepreneur. Well, in short, our mission is simple: to ensure you don't just practice in Canada, but thrive, grow, and build a future you envision for yourself and your family. With that, I'd like to leave more times today for the respected representatives from MCC and CPSA, who will be sharing crucial insights on licensing and regulatory pathways. Please feel free to connect with me or my team afterwards if you have any question. Thank you again, and I look forward to discussion today. I'll hand it to Muso.
Thank you for that, Harpreet and Sham, for providing. Now, for most of you, I know you want Harpreet back because you have a lot of questions on immigration. Harpreet will be back to speak at the very end of this session. But now, let's speak about you, the GPs. If you are in the UK and now you want to come into Canada, there's a license pathway that you have to follow. So for now, let's hear from Dr. Felipe Santos. He's the special advisor for MCC representative, and then he'll take us through this. Dr. Felipe.
Hi, everyone. Nice to meet you. I'm the Special IMG Advisor for the Medical Council of Canada. The Medical Council of Canada has one of its strategic pillars is to increase the number of international physicians practicing Canada to support them on their journey practicing Canada. There are many opportunities in Canada across all the provinces. And the one thing that a lot of people don't understand is that each province here is autonomous in how they regulate the profession, and they put the requirements that are needed to practice medicine in that province. So the CPSA will soon talk about the process for Alberta, but I would like to mention that there are other opportunities as well. And that by being licensed, for example, in the UK and having an active license as a GP in the UK, you would also be eligible for a defined license in Nova Scotia. And if you go through the process with the College of Family Physicians of Canada, and you are able to obtain the certification without examination, excuse me, you would also be able to practice in many other provinces, including, for example, British Columbia, without having to do the MCC examination. If you do happen to do the MCC examination with the certification of the College of Family Physicians, with the both things, you would be eligible in any province. So we at the MCC are here to help you, guide you through the process. Many of the registrations with these regulatory bodies will happen through the physiciansapply.ca account, where your documentation will be verified. So usually you need to update your identification documents, such as your passport, your medical degree, and potentially your training documents will be uploaded and source verified on Physicians Apply before you can proceed with registration in many of the provinces, except most of the provinces, except Ontario. They do their own source verification for their documents. And if you have any issues doing that, our service desk is more than welcome to help you. They will assist you in each of the process. Keep in mind that some of these source verifications may take time, and it's not even related to the MCC. It will depend as well on your home institution, how long they take to source verify these documentations. And most of the regulatory bodies will rely on the MCC and on the Physicians Apply to do those source verifications prior to giving your license to practice. So if you have any questions, let me know. And also we have our service desk available.
Thank you for that overview, Dr. Felipe. Thank you so much for that overview. Well, let's give a chance now for our CPSA representatives to actually come on as well. And let's call upon Dr. Sarah Kandeka at this time. Dr. Sarah from the CPSA, please.
Hello, thank you very much for the invitation. I think Kennedy is going to be sharing some slides for both me and Chantel. Here we go. So thanks for inviting me to provide a little bit of information about our eligibility requirements specific to Alberta. As Dr. Santos mentioned, each province and territory has its own regulator, and with each regulator and their own legislation, they will also have their own individual sets of eligibility criteria. What Dr. Santos didn't mention is that he and the MCC have put together a very helpful ebook. Dr. Santos, you should have plugged your book. It's a great book. the ebook that outlines all of the considerations for the different provinces and territories. They do try to keep that updated as each of the MRAs, the regulatory authorities, will change their requirements. The ebook is supposed to be getting updated, so it's probably due for some updates on almost a weekly basis. Registration considerations in Canada right now, especially across the world, but definitely in Canada, are changing rapidly. So what I will tell you in this presentation is I'm going to present our eligibility criteria as they stand right now. We're going to keep it very general to the eligibility criteria as they are right now because these things are changing quite frequently. I will strongly encourage you to look at the website for CPSA or any regulatory authority that you're seeking licensure in. That should be your first stop. Well, no, your first stop could be the ebook from MCC. Your second stop should be the website for the college of the province that you would be seeking practice in, because they all have different considerations. So we'll just jump into the presentation. So just in general, what CPSA and most other regulatory authorities across Canada, what they do and what they don't do. So these are regulatory bodies. We register physicians and physician assistants. We support the physicians in their continuing competence needs through the regulatory authority. We accredit facilities, we manage complaints, we guide physician professional conduct and ethical behavior. What we don't do is recruit. We don't do the recruitment. We don't give hospital or acute care privileges or operative privileges. We don't direct you as to how you run your practice, and we don't determine where you practice. And we don't actually influence the actions of other regulated health professionals such as nurses or pharmacists. Okay, so the registration process with CPSA. Here is the eligibility criteria. We had a number of questions before the session began, and so this is probably the slide that everybody wants to take screenshots of. What you need to be eligible for independent practice in Alberta, you need a medical degree or an osteopathic degree. And the medical degree needs to be from a school that is listed in the World Directory of Medical Schools. You need to have successful completion of discipline-specific postgraduate training. So in the case of the GPs, you need successful completion of family medicine training. And there are specific rotations that are required for Alberta. You need to have 4 months of community-based primary care and a minimum of 8 weeks in 3 of the following. You need to have a minimum of 8 weeks in pediatrics, obstetrics and gynecology, surgery, and internal medicine. So that is 4 different rotations. You need to have a minimum of 8 weeks in 3 of those. If you have, because that would be the standard for the scope of practice of Canadian family physician training. If you have successful completion of that and certification of that postgraduate training, so in the case of the UK, you would need to have your CCT and your MRCGP, as well as currency of practice. So for currency of practice, the definition in Alberta, because that varies from province to province, the definition in Alberta is you need to have at least 1 year in the last 3 years in practice or in postgraduate training. The 5th eligibility criteria is a registration examination, and that would be successful completion of your LMCC or the equivalent. In the US, you would have the USMLE or the COMLEX exam for the osteopaths, but you would need to have a registration examination. So then you have the 2 registers that we talked about in Alberta that would allow physicians to be independent practitioners. You have the general register, so that is generally general registers for Canadian graduates that have Canadian certification. So in the case of family physicians, it would be CCFP, Canadian College of Family Physicians Certification. If you were a specialist, you need Royal College certification of your training. And then if you're from outside of Canada, an international medical graduate, you need certification from an approved jurisdiction. The approved jurisdiction is a defined list of jurisdictions. It's listed on our website. It's also listed on the Royal College website as well. And if you have certification from one of those jurisdictions, that jurisdiction has been deemed equivalent to the Canadian certification. So if your certification is from that list, you would be eligible potentially for the general register if you meet all of the above criteria. If you don't have your Canadian certification, you're eligible for the provisional register. So this would be any Canadian graduate who doesn't have certification. So we have Canadian graduates who've been unsuccessful in their Canadian certification exams. They would be eligible for the provisional register until they get their certification exams. And then international medical graduates from certification outside of the approved jurisdiction list would be eligible for the provisional register, and they would need to undergo what's called the PRA, or the Practice Readiness Assessment, the PRA program. That is a 6-month assessment process, after which, if you successfully complete the PRA, you're eligible for practice on the provisional register for up to 6 years. During those 6 years, you obtain your Canadian certification. If you don't obtain your Canadian certification, we have an assessment of your competency that then would allow you eligibility for the general register. That's the eligibility. Okay, and then, so more on the approved jurisdictions. This was a change that we made here in CPSA about 2 years ago, where we introduced the idea of the accelerated jurisdictions. So anyone from a defined list of jurisdictions that's listed on the website 2.5 years ago at CPSA, that allowed eligibility for an accelerated PRA process. So you didn't need the first 3 months of the PRA. You could immediately start independent practice in the second part of your PRA. And then in June, we announced at CPSA that all of the people with certification from these jurisdictions would now be approved for eligibility on the general register. This was a huge change and has generated a lot of interest in Alberta, because what it means is if you have your MRCGP and your CCT, you would be eligible for independent practice right away. No additional examinations. Your requirement for the LMCC is waived. Your requirement for any assessment is also waived. Okay, so this is the overall registration process. This was the other set of questions that we received. So what's the process for registration in Alberta? This is all on the website. I will encourage you to check out the website after the presentation to become more familiar with it. This is all there. The first thing that you do is you go onto the Physicians Apply website hosted by MCC, create an account, and you submit your review of qualifications to CPSA, to Alberta. That allows us, that's our preliminary review of your qualifications, to let you know if you may be eligible to apply according to our current eligibility criteria. It's not a full application. It's you submitting as much information as you can to us. And our registration team leads will review that review of qualifications and respond to you about whether or not you may be eligible or you may not be eligible. And if you're not eligible, why not? Once you get your eligibility letter back from us, then there's if you are eligible to apply, we set up a tracking page that will have a checklist of all the documents you need to submit to us. And that would be your criminal records checks, your certificates of professional conduct, verification of your training, and your other certifications. Once we collect and verify all of those documents, then your file is signed off and approved. Then you're issued an invoice to pay your fees for application. There's orientation courses that all new registrants in Alberta need to take, and you're given instructions on how to complete those modules. It's usually about 90 minutes to 2 hours worth of modules. It's not onerous, and it just gives you another way to orient yourself to practice here in Alberta. Then you're issued your registration understanding and acknowledgement, or your RUA. And that's your registration agreement, and then you're given your practice permit. So timelines, this was another set of questions that everyone had. So your review of qualifications, that preliminary review of your application to determine whether or not you're eligible, on average, it's taking us about 4.5 days to respond to those. That is actually a bit longer than our usual, since the changes that we announced in June. We've had a huge uptick in the interest and the number of RQs coming through. But that isn't the average amount of time that you'll get a response from us about whether or not you may be eligible to apply. The registration process itself, once all of the documents are submitted to us and verified, this is the rate limiting step. But once we have all those documents, on average, we're applying with a registration decision in less than 1 day. Really, the delay is in getting all of the external documents to us. So if you are if you're in the application process with us, the more quickly you respond to us and the more quickly you try to get those documents to us, the faster the registration process will go. And that is essentially the registration process and timelines. And I'll hand it over to Chantel.
Thank you. So under the Health Professions Act, we are required to have standards of practice to provide consistency in how health professions are regulated. Standards are not guidelines, nor are they optional or suggestions. The standards are minimum expectations of professionalism and ethics and mandatory to follow. However, they're not meant to be aspirational in nature. They need to be reasonably achievable by all CPSA regulated members, hence the minimum expectation. And again, not optional. I can't stress that enough. I hear often they referred to as guidelines, and they're not guidelines. They are mandatory to follow. So physicians are expected to at least be aware of them. They don't necessarily need to be able to quote them all, but you should have an understanding of the ones that apply to your practice, or know where to locate them on the website to educate yourself if something new arises. Kennedy, we can go on to the next slide. So all new standards of practice and updates to existing standards must undergo formal consultation with CPSA members, partner organizations, and the public before being considered for approval by council. The Health Professions Act also requires colleges to provide a copy of proposed standards or amendments to the Minister of Health for review and comment. While the minister does not approve the drafts, we must wait for ministerial feedback before standards can go to council for consideration for approval. When we're updating standards or writing new ones, we do jurisdictional scans to determine what other areas are doing on a topic. For example, the other regulatory colleges in Alberta, the physician and surgeon regulatory bodies across Canada, and internationally, like the Medical Council of New Zealand, as an example. Canadian physician regulators meet quarterly to discuss issues that are arising for awareness and collaboration. Most standards are accompanied by advice to the profession documents that support members in implementing the standards in their practice. These documents are not legally binding like the standards are. The standards are the you musts, the advice documents are the here's how. They're more nuanced and detailed than standards, will often have example scenarios, that type of thing. So they can be very helpful in understanding how a standard applies and how to implement it. We're implementing a new step in our review process that will consider if a standard can be reaffirmed, renewed, or retired. This should allow us to shorten our review cycle from every 5 years to every 3 years. So standards will be reviewed every 3 years, including that jurisdictional scan to determine if a standard can be reaffirmed, meaning it's still current and doesn't require updates, if it does need to be refreshed with updates, or if it's no longer relevant and can be retired. So there are currently 41 standards and 42 advice to the profession documents. When reviewing standards, we do try to determine if some of them can be combined or if some can be rescinded to reduce the overall number. We know that's a lot of standards, but again, they're in place to help guide the profession and keep the public safe. We've also been developing advice to Albertan documents to provide information to patients in plain language on what to expect from CPSA regulated members in healthcare setting. These documents can also be really helpful resources for members to share with patients to demonstrate CPSA's expectations. So for example, the personal and sexual boundary violation advice to Albertan document explain why physicians shouldn't accept extravagant gifts from patients and outlines why it's inappropriate to ask your doctor on a date. So think of it as you can kind of point to that as CPSA is the bad guy and says, I can't go on a date with you. So it just sort of helps keep boundaries a little clear. One of the questions that was asked in the registration process was around discharging difficult patients. As you can see in the little call-out box here, the terminating the physician-patient relationship standard is one of our most commonly referenced standards. We do have fairly clear expectations on when patients can be discharged, as well as the steps that must be taken to do so appropriately. So generally speaking, you do need to provide a patient with appropriate notice to try to find a new healthcare provider, ensure they understand how any outstanding investigations might be followed up on, how to have copies of their records transferred to a healthcare provider, and so on. However, we do also have a clause in that standard that allows for immediate discharge if a patient is abusive, threatening, if they fail to respect professional boundaries, etc. So we do not expect physicians to put up with bad behavior just because there's an established physician-patient relationship. We absolutely understand that physician safety is a priority and needs to be considered in certain situations. To that end, though, the bottom line is always document, document, document. Any type of a situation like that, be as thorough in your notes as possible, because that's your rationale if a patient needs to be discharged. That was standards of practice in a very quick nutshell. I'm not sure who we're passing it off to next. Sorry.
That will be me, Chantel. Thank you so much for Dr. Sarah and for you, Chantel, on the CPSA presentation. Now we're going to have Harpreet come on again. There's a lot of questions basically on the immigration process, etc. I'm going to let Harpreet speak. I'm just going to present this time around, and then we're going to have a Q&A session after that. Harpreet.
All right, thank you, Muso. So we are going to start with the first thing is the work permit process, because whenever the job offer is secured, the first process to immigrate to Canada would be the work permit. So there are type of permits that we can request for physicians. First one would be LMIA-based work permit. So for LMIA-based work permit, employer, which will be a Canadian clinic, so once the need of doctor is identified by the clinic, we guide them step by step on while processing the LMIA, including arranging, preparing documents. So the complete application has to be submitted to Service Canada, which is also called ESDC. So once the application of a labor market impact assessment is submitted to the Service Canada, employer is required to do the recruitment efforts and submit all the supporting documents. So basically, employer has to convince or give the information to Service Canada that they tried hiring the foreign workers, especially physicians, inside Canada, but they are not able to secure a doctor. So they are trying to find a physician overseas. That's why they need LMIA-based job offer. And so usually there's an interview process involved that employer or Canadian clinic get interviewed by Service Canada. And once that process is complete, so LMIA is approved. Right now, the processing time is in priority, but it's still somewhere from 1 to 3 months, depending on the workload they have. So LMIA process and the placement process goes side by side. Once employer starts the LMIA process, we come in the picture where we start the placement process. We identify the need and requirements of the clinic, and we match with the suitable doctor profiles. And therefore, we start the process of screening, interviews by the clinic. And once both parties agrees to the terms and conditions, a formal job offer and contract is shared with the doctors. Once everything is signed, LMIA is ready, then the work permit process will start. So for UK nationals are visa exempt from Canada, which means they would still need to apply for ETA. So ETA is applied online from IRCC's website. It's usually very quick. Sometimes it takes a couple hours or immediately approval as well. So on an average, 72 hours of processing time on and off, and $7 is the government fees that you have to pay. So ETA is linked with your passport. So once we have LMIA and job offer contract, all the supporting documents, including your experience letter, your education documents, and your ready to practice approval from provincial licensing body, then we attach all that to your application. Work permit can be applied online. Some people prefer to do it online. Why? Because the approval comes before they can travel, so they make sure everything is in line. So when they land in Canada, they can CPSA officer will issue them a permit. Other one would be C10 work permits, the next one. So C10 work permit is again another type of work permit. It's usually issued if the position is bringing significant benefits to Canada. So doctors are in that type of in that type of permit. So again, still the job offer and the contract would be still required from the clinic to support you for C10 permit. It can be applied at the airport as well if you are from a visa exempt country like UK. But for people who are not visa exempt, like they're not UK nationals, they will have to apply for the permit beforehand online, get the approval, only then they can travel to Canada. So the visa exemption is only for UK nationals. Please keep that in mind. The third one would be port of entry work permit. So we do provide assistance with port of entry documentation package where UK nationals, as they're exempt, so we assist them with the ETA processing, and upon landing, because they didn't apply online beforehand, so they need to bring the package. As I said, experience requirement. There might be a upfront medical requirement that has to be done from the approved panel from IRCC, and other supporting documents. So when they land at the Canadian airport, CBSA, Canadian Border Services Agency's officer, will interview you, check all your documents, make sure you're meeting all the requirements to get the work permit, everything is in line. And so once the assessment is complete, they will issue you a work permit. Depending on the job offer duration, it could be up to 3 years of duration. Next, I would discuss the immigration pathways for doctors in Canada. So even if you have work permit or if you don't have work permit. So I will discuss for the doctors who are already in Canada and have a valid work permit, LMIA based or LMIA exempt. So there are two main pathways that Canada offers for the people who have work permit in Canada. So doctors fall in the healthcare priority sector. The federal pathway is express entry. I'm sure most of you already know that. The express entry, you're familiar with the term. So it's a point-based pathway where Canadian system, IRCC, has made a system where you get points based on your age, your marital status, if you're bringing your spouse with you, for permanent residency, based on your education, your language, your work experience in Canada, or if you have a foreign experience, you can also get points for that. And if you're bringing spouse with you, spouse is accompanying you for permanent residency, you can get additional points based on spouse's education, spouse language, and work experience as well. So there are separate points a lot for spouse. Spouse criteria is separate as well. So for Canadian experience, in order to qualify for express entry under Canadian experience class, you will need to have at least 1 year of Canadian work experience in last 3 years. Once you complete that 1 year of work experience, you will qualify under Canadian experience class. But again, because it's a point-based system, so as you are towards higher number of age, the points start decreasing. So invitations are based on the total points that you're getting after we submit your expression of interest. So once the expression of interest is submitted, IRCC send invitation regularly. There are category-based draws, healthcare-based draws. So most of the physicians get draw in the healthcare priority sector. And once you get the invitation, you have up to 60 days to complete your application, where you can include all your dependents, and children under the age of 22 are included as dependents. Doctors who are outside Canada, they can qualify for express entry as well, but they will qualify under something called federal skilled worker criteria. Again, it has to be point-based system, so it depends on how many points you're making, what's your language score, based on if you are making points. Right now for Canadian experience class, we got the invitations today. It was around 535 points. So based on points, if you are at that point line, you will get invited. Otherwise, you'll have to wait until the scores goes down, and then you get the invitation. Second pathway would be at a provincial level. So each province has their own criteria to invite candidates for permanent residency. So with the provincial, let's say for Alberta province, they have again point system where the points are allotted, and then your position title like NOC code, National Occupation Codes, are given to your occupation. So you have to select the right NOC code. You again need to submit the expression of interest. And if you get invited based on your NOC code or based on your points, you get invited, and that's how you submit your provincial nomination application. So provincial nomination application would be two-step PR pathway. So if you're getting invited through provincial nomination, if someone is not qualifying for express entry, that means they have a backup option to qualify for provincial level. So if you get invited in provincial level, you get the nomination, and then you submit a second application, which is called Federal Permanent Residency application. So timeline varies for express entry. Right now the processing time is somewhere from 6 to 8 months, or even quicker for healthcare sector. And for provincial nomination, it could take a bit longer because the processing time varies. But right now it's on a bit higher side. But as I mentioned, express entry and provincial, there are both pathways available for physicians. And based on points, you can get invited in both as well. The last one would be the family sponsorship. Doctors, physicians qualify to bring their spouses with them along with children. The spouses will get open work permit for the same duration as the physician's work permit, like a primary applicant. And the children, if they're school-going age, they will get study permit, and they can study till grade 12 free of cost based on the work permit of the primary applicant, which is physicians. And if they are not school-going age, they will be issued a visitor permit. It's called visitor record till the permit validity of physicians. Children can go to school. They will have access to free healthcare, free studies, and other than that, they can also be added into your permanent residency application where until the age of 22. I got a question that we received a question where they are like physicians asked about the parents because they're elderly, if they're able to visit them in future. Yes, even though your work permit will be linked to the clinic that supported you for the work permit, it's closed work permit. You are still able to travel back and forth to your country of origin as long as it's there. There's no restriction on how long you can go, but we always recommend to keep it in a shorter time period. 3 to 4 weeks vacation is completely fine. Again, if there is a good reason to have extended vacation or extended holiday request, then that is also doable. For parents, once the physician is here on a work permit, they can invite their parents on a visitor visa. Visitor visa validity is up to 6 months, but it can be extended once they are here. So they don't have to leave if they don't want to, but we need to make sure that we are applying for extension before their status expires, which is 6 months. Other option would be applying for super visa for parents. So for super visa, there is an income requirement. Once you complete 1 year in Canada, you have to file taxes, and then the notice of assessment is issued by CRA, Canada Revenue Agency. So your income has to meet the requirement for super visa. Income requirement varies with the family size. And so there is a very detailed information on how much income is required if there is a family size of 4 or 5, and then adds on to each additional family members. So once you have your notice of assessment and you're meeting the income requirement, most physicians are, so then you can sponsor your family, both parents or grandparents, on super visa. So for super visa, your parents can stay up to 7 years once they land in Canada, first 5 years, and then they can apply for another extension and for another 2 years. So they can stay continuously in Canada with you for up to 7 years. There's another pathway where you can sponsor your parents for permanent residency. For that, IRCC Canadian government assess your last 3 years of income to qualify to sponsor your parents for permanent residency. There are other more requirements that we can give personalized guidance once it's needed. But yes, that is possible. So parents can get permanent residency through children if you sponsor them, if you're meeting the income requirement, that is one of them. And that's how the parents can stay in Canada, and you can also visit them. So that's pretty much it in terms of immigration side. But yes, if you have any more questions, you can please send that to us and we will try to answer. Again, we do offer one-on-one personalized consultations for you to guide step by step on. Once you start thinking about Canada, it has to be planned. It has to be in a way that you understand the timelines, you understand that what is expected and how long it's going to take, what are the pathways, and you choose the best one that is suited for you. Thank you so much, everyone, all the attendees that were able to join us today. And I want to thank CPSA and MCC speakers again for giving their time and so much information for today's webinar. We are looking forward to assisting you in your Canadian dream. Thank you so much.
Thank you so much, Apreet. I just want to, respectfully give like 30-second closing remarks for everyone. Maybe we can start it off with, Dr. Felipe Santos, just to wrap up 30 seconds, and we go to Sarah and Chantel, then Apreet and Sham. Then obviously we'll close it up with you, Maibu. Dr. Felipe.
Thank you so much. I want to thank everyone for attending. I commonly answer questions on my Instagram. It's philippesantos.md. So Philippe is FILIPESANTOS.md. If you go to my Instagram, I commonly put on stories question boxes. I'm happy to answer questions there. Sometimes I'm able to answer questions on the DM as well. But if you have questions that are specific to the Physicians Apply or to how you're uploading your source verifying documents with MCC, or that are related to the examinations, please contact directly the service desk at the MCC, as they will be the most knowledgeable people to be able to help you and guide you. And good luck on everyone coming to Canada. We really need you here, so we will welcome you with open hands. Thanks.
Thank you. Thank you, Dr. Felipe. Dr. Sarah, please.
Thanks for the opportunity, and thanks everyone for the interest and the enthusiasm. Again, I think very important that you look at the website for CPSA or any other province that you might be interested in, as it will outline the specific eligibility requirements for each of those places. And these eligibility requirements do change, and they can change quite rapidly. But most importantly, know that if you believe that you meet the eligibility requirements somewhere, submit the application. That's the best way for you to get the proper consideration of your file. Asking one-off questions is not going to give you the best opportunity to get all of your qualifications assessed. So yeah, with that, thanks. Good luck, everyone.
Thanks, Dr. Sarah. Chantel, please.
Yes, thank you for the opportunity to share a very quick snippet of our standards of practice. Going to echo what Sarah had said. They're all available on our website. There's contact information at the bottom if you have questions. So yeah, just reach out if you don't find what you're looking for on the website.
Thank you. Thank you, Chantel. Harpreet, word from you, please.
Yes. I want to thank you, everyone, especially MCC and CPSA speakers, for joining us today, giving us so much information and answering the questions that people have had. And also to Dr. Mahibur for giving us the time and sharing so much information today. I want to thank all of the attendees that were able to attend our webinar today. The recording will be available on our YouTube and our website as well. You can also reach out to us through our website. You can book a consultation where we provide one-on-one guidance. You can also email your concerns at info@canpathways.ca, or you can send it to me, harpreet@canpathways.com, and I'll be happy to answer any of your questions that you have. We are here to guide you step by step. So I understand doctors have so many concerns when they are planning their first thought of planning to coming to Canada. So from day one to scrolling through CPSA and MCC website, where to start, how to start, who to contact. So please reach out to us, and as per the CPSA MCC guidelines, we will try to guide you through the right resources where you can get the accurate information about licensing and certification. But yes, if you need any assistance with immigration and work permit, permanent residency, definitely reach out to us. Again, thank you so much to all of you for attending today.
Thank you, Apreet. Sham, a word from you?
Definitely. Well, thank you once again to MCC, CPSA, and my group for your valuable time, and all the doctors who have joined today. And well, we are here. Me and our team is here for all the doctors who are ready to, begin their Canadian journey. We'll be happy to support there. Thank you once again, everyone.
Thank you. And Dr. Maib, finally.
Yeah, just really huge thank you to all of you for taking time out in the evening, for joining, for asking some great questions. Big thank you to the CAN Pathways team, and huge thank you to Dr. Felipe, Dr. Sarah, Chantel, the whole team for putting it together. Really nice to see that we've got such a varied panel from the different angles to cover different things that people are interested in. I know some people have asked whether we might do something to cover other areas or other jurisdictions. While we might not have time to do a full webinar, we may be able to put together some of the information. And what we will do is look through some of the questions and maybe put together an FAQ or something like that and send it out in due course. Okay, so huge thank you to all of you. All the best. And if you've got those of you that have got questions that you think that I can help you with, or if you've got questions about UK careers, CCT, some of you might still be doing your exams, MRCGP, you can always get in touch with me. If you've got questions, you want to actually start this journey, maybe you want to see what jobs are out there, contact the CAN Pathways team. They're here to support you. And then you've got the different websites to get the step-by-step information for registration, licensure, and you can always reach out for individual questions. Huge thank you to all of you, and all the best with your journey.